The children's wards of Malawi's main hospital, in its capital Lilongwe, receive a minimum of government funding in one of the world's poorest countries which is struggling with major corruption. Sick children share beds, surgeons lack the basics to operate, disposable equipment is reused, children with cancer are a low priority.
Especially with the devaluation of the kwacha and funding issues, we have been experiencing drug shortages, especially essential drugs. And because the cancer drugs are not really included in this essential drug list, we regularly run short of these drugs. And if the child develops a complication or has an infection, then we're not able to treat them as effectively as we would, not just with the chemotherapy, but with other antibiotics that we may need or antifungals that we may need to treat them.
Yet 50 yards away, the hospital's outpatient clinic for HIV-positive children and parents is state-of-the-art thanks to US charitable funding. Doctors like Alison McKenney, who work in both places, regularly take across drugs to help the children's ward.
The doctors who are paid very little will use their own funds to go out and buy essential supplies for the hospital, antibiotics, adrenaline, asthma medications, tape, cannulas to put in IVs.
She remembers first seeing the overcrowded ward, which deals with up to 400 children a day, where clinical officers and nurses are overstretched and parents have to become like nurses to their children, some of whom are forced to sleep on the floor.
Walking from Baylor to KCH Hospital the first time was like stepping into a different world. The hospital functions with the absolute bare minimum essentials. One child here would be dying, one child would have diarrhea, one child with pneumonia, all in the same bed. Come to realize now that there is a sense of organization to the chaos. These children are getting good care. However, it would be so nice to see them each have their own bed.
Shortages mean surgeries for emergencies and usually not possible for the cancer children to remove tumours. And sometimes the chemotherapy drugs aren't available to treat very curable cancers like Burkitt's lymphoma, a swelling of the jaw.
There was a time when we didn't have chemotherapy. Patients stayed in the ward without chemo, and we ended up discharging some of the patients to go home, and we told them we'll call you when we have drugs, but some of them, they ended up defaulting, they never came back.
Luckier is 12-year-old HIV-positive Tapson, who has a large abdominal tumour.
Yeah, at the moment we have the drugs because we got some drugs from the donors recently, but had it been that he came maybe 3 or 4 weeks ago, we had problems with the drugs.
20 cancer patients, many malnourished with low immunity due to chemotherapy, have to make do with 15 beds in a large ward where other children have infectious diseases like pneumonia, TB, diarrhea and malaria.
For example, the oncology patient, the immunity goes down, and when we mix with malaria patients, TB patients, diarrhea patients, they easily catch infections. So quite often they have respiratory tract infection, sepsis. So if we could have a different accommodation for the oncology patients, that would be of great help.
Parents with few resources find it difficult to stay, and that can endanger successful treatment if the chemotherapy is not finished. Or they're forced to stay like 11-year-old Marine and her mother for months, leaving behind family in a hospital lacking child-friendly facilities, few toys and only one teacher for 400 children. Marine had a very painful mass on her leg and groin, but the hospital had no suitable narcotics to help her.
It's extremely uncomfortable, and we didn't have any pain medications to offer her other than Panadol or Tylenol, which is used to treat simple headaches. So she was left with a tremendous amount of pain until we were able to start our chemotherapy and treat her.
World Child Cancer and other charities are looking into providing more funding for the cancer patients, including a separate ward, improved diagnosis and financial support for parents. But there's a long way to go.
People are neglecting cancer patients. I feel it's also very important to be considered, because if more attention is given on the cancer patient, more patients can be cured, just like the HIV and TB patients.
I think about what more we could do if we had more money, more funding, more clinicians for these children.
If we were to have regular supply of essential drugs, it would help to reduce the frustration.